Alright, so our treatment for rheumatoid arthritis, if there was a lot of swelling in the wrist, you could start with manual lymphatic drainage. So starting in the neck, can't really do it, but along the SCM, you're going to do nodal pumping on those nodes. So using 2 fingers, you're just gonna poke them 5 to 7 times. And then in the axilla, you're going to use this like part of your hand. You're going to just go like that in the axilla. And then you can do C's, so make a C and then just squeegee it on the arm. And then make circles on the wrist to help stimulate the fluid. And then you'll finish on the neck again, doing the nodal pumping. And then you would start with your fascial assessment. So assessing restrictions along the arm, skin rolling, along the hand and wrist. Be gentle. Sometimes the arthritis can be quite severe, so if they did have fragile skin, don't do this. That's a contraindication, as we know. Once the fascia is worked on, you can just start with your effleurage along the upper arm. I'm not using oil today because I can't, as you probably figured. Do some effleurage. And then do some petrissage. Kneading. Some ringing. Some open C's. Do some frictions if there was a lot of adhesions on these, some deep transverse frictions. Finish off with some effleurage. And then working into the forearm muscles. Same thing, we're going to start with some effleurage, some petrissage, do some ringing along the extensors, some open C's. Some more specific petrissage. Extensors do tend to be quite tight. People with rheumatoid arthritis in the wrists have difficulty using their hands. And do the same on the flexors. After we do all of our petrissage on those, we want to stretch the flexors and extensors. So we'll just do a manual stretch. Hold it for 30 seconds. Hold both of those for 30 seconds. We're going to work in the hands. If there's any adhesions, just general massage. There's also likely going to be limited range of motion. So if it's not too swollen, we can do joint mobs. So if there's limited flexion, we can do a palmar glide to help increase that range of motion. So you're just going to put your finger on the proximal row of carpals. You're just going to do a palmar glide. So I'm like pushing up. You can do a grade 3 oscillatory glide to help increase the range of motion. If you wanted to increase the extension, you can do a dorsal glide. So I'm going to push it like that. And then I'm just going to finish up with the hand. And that is my treatment for rheumatoid arthritis. Usually it affects people's joints bilaterally, but I just did one limb for today. And that is all.